Welcome, everybody. How's everybody this morning? It is 11 a.m., so it's time to get started. This is Larry Cade from the Healthcare Authority, the ERB program. This is a webinar today for the FSA plan design for 2023. We are lucky to have Chelsea and Sally here from Navia. And if you could, use the Q&A feature to answer the questions. Sally, are you ready to go?
Yes, I am ready. All right, everyone. Hello, my name is Sally Lindsley. I work at Navia. I'm an account manager on the PEBB plan. For those of you who may not know, Navia is the administrator for PEBB's FSA and DCAP benefits. I also have Chelsea Allen is here with me to help answer questions. She is also on the PEBB account with Navia. So we'll just go ahead and get started. All right, so today this presentation is really going to focus on kind of two topics, and those are the carryover and the limited purpose FSA. We're really going to be talking about basically the medical FSA and limited purpose FSA benefits and how the carryover applies to those. We won't really be talking too much about the DCAP benefit today, but of course, if you do have questions about any of our benefits that we administer, please feel free to ask those. You can use the question answer chat to put your questions in throughout the presentation. And then at the end, we will have some time for QA, and I will go through those and answer your questions. But we'll just run through the presentation first and then do the questions. So to kind of start off, we're going to talk about the carryover. The carryover was a new feature that was added to the medical FSA and limited purpose FSA in 2022. That was the first year that we introduced the feature. That being said, people probably are not really going to experience carryover for the first time until 23. So what carryover is it's an option that allows folks to as the name says, carry over funds that they have left at the end of each plan year into the next plan year. So before the carryover existed, there was just a deadline that you had to spend your FSA funds by. And if you hadn't spent all your money by that deadline, then it was forfeit back to the plan. What the carryover does is it lets you get to keep at least up to a certain amount of your money if you meet certain requirements, and that can roll over year to year. The limit for this carryover in 22, and when I say 22, I mean the money that would be in people's current year 2022 benefits that is going to carry over into 2023. The limit for that was $570. This year, or this new open enrollment period we're talking about, which is the 2023 plan year, that limit is actually going up. And that's what you can see here on the slide. It's going up to $610. So at the end of the 23 plan year, which is what people are signing up for during this open enrollment period, they will be able to carry over up to $610 into 2024. There are also limits on the benefits on both the medical FSA and limited purpose FSA. You can see it here at the bottom of the slide. There's a minimum and maximum. The maximum amount you can elect for the 2023 plan year is going to be $2,850. And then there is a minimum of $120. So you have to sign up for at least $120, and the most you can sign up for is $2,850. The carryover, the minimum does also apply to carryover funds, and we'll get into more detail on that coming up. So how does the carryover of funds work? So like I said, employees can carry over up to $610 of unused funds at the end of 2023. These carryover funds applies to the medical FSA and limited purpose FSA benefits. It also is something that applies to folks who receive the $250 medical FSA funding as part of a collective bargaining agreement, which we'll get into more detail on that on a future slide. Carryover, however, does not apply to the DCAP. That's an important thing to keep in mind. The DCAP just has a kind of a hard deadline, end of the year, you need to spend your money. And if you were not able to spend it, then it will be forfeit back to the PEBB plan. In order to receive carryover, you have to meet one of two requirements. Employees either must enroll on the next year, in this case being 2024, on either the medical FSA or the limited purpose FSA, or they have to have at least $120 left in their 2023 FSA, whether it's medical or limited purpose, at the end of the year. And again, we'll get kind of into more detail of some examples about kind of how that would play out on a future slide, but they do have to fulfill one of those two requirements in order to receive the carryover of funds. The reason that employees must either enroll or have that minimum is by enrolling in 2024, they are by default meeting the requirement, that $120 minimum with their new plan year election. But if they haven't made a new plan year election, they did not sign up, they still could be eligible for carryover. They just have to meet that $120 minimum in order to receive the funds. Carryover also does happen automatically. It is not something that employees have to like opt into. As long as they meet these requirements, they will receive those funds automatically. And then again, any funds above that $610 will be forfeit. They cannot carry over more than $610 from 2023 into 2024. Okay, and so another important component of the FSA benefits is deadlines. So all medical FSA, DCAP, limited purpose FSA, all of these benefits are annual benefits. Employees must sign up year to year in order to receive the benefits. They don't roll over automatically. Their elections do not. They must make a new election every single year. These elections run the course of the calendar year. Basically, if they sign up during open enrollment, the start date of their benefit is going to be January 1st of 2023. And the end of the plan year, the last day, is December 31st of 2023. The last day to incur, which by incur, we mean actually the expense needs to happen. So whether that's going to the doctor, having surgery, picking up a prescription, or making an over-the-counter purchase, those things need to actually happen on or before December 31st. That's the deadline. If you go to the doctor on January 1st, that expense will not be eligible under the 2023 benefit. You would have to sign up for 24, have those carryover dollars to pay for it at that point. And then there's the last day to submit claims, which is March 31st of 2024. So while that last day to incur is the end of the year, there is some wiggle room for claim reimbursement. This is really to help people out who, maybe go to the doctor at the end of the year. It typically can take a few weeks to even a couple of months sometimes to get your paperwork, your explanation of benefits, that sort of thing from the doctor. So, if you're going to the doctor on December 27th, you're probably not going to get your paperwork till maybe January or February. This allows folks to still get reimbursed for those expenses that happen late in the year. Or if someone just maybe lost their receipt, forgot, they have, again, a little bit of wiggle room, an extra 90 days to get those claims into Navia and to be reimbursed. Going to take a little bit of a detour here to talk about the $250 contribution provided by PEBB to represented employees. This is a benefit that started in 2020. It's a benefit that was negotiated as part of the most recent collective bargaining agreement. So represented PEBB employees whose annual rate of pay on November 1st of 2022 is $50,004 or less are eligible to receive $250 towards a medical FSA in January. So they have to qualify again November 1st of this year, and then they would receive the money in January of 2023. In order to receive those funds as well, they cannot be enrolled on the high deductible the CDHP plan with an HSA for 2023. They also cannot waive PEBB medical coverage unless they are enrolling as a dependent on somebody else's PEBB medical plan. They need to be covered by a PEBB medical plan in order to receive the funds. That is not the CDHP with HSA. They are not eligible if they terminate, retire, or lose coverage by the date the benefit is distributed. So if somebody were to, leave employment on December 31st of 22, even if they had qualified on November 1st, they would not receive the funds at that point. If a PEBB employee is eligible and they haven't already enrolled on the medical FSA in 2023, they will automatically receive the $250 in January. They'll receive a Navia debit card that will allow them to spend the money directly. We'll get into some more details on that later. But they will just get that $250 upfront in January. If they did enroll themselves, they signed up for a medical FSA in 2023, then they will actually get the $250 loaded on top of whatever their 2023 election is. And that includes if they sign up for the maximum amount. If they sign up for that $2,850, they can still sign up for that, and they will get $250 on top of that for a total of $3,100. Okay, and so going back to the carryover and how it interacts with the CDHP. So employees who enroll on a consumer-directed health plan or the CDHP with a health savings account or HSA in 2024 will still be eligible to receive carryover. This isn't going to make anyone lose eligibility. Their leftover 2023 medical FSA funds, again, up to $610, will carry over into a 2024 limited purpose FSA. So this is actually why the limited purpose FSA was implemented on the plan last year, was to ensure that folks who, change health plans between years don't lose out on carryover. The limited purpose, really, its benefit is that it can be used alongside an HSA, whereas the medical FSA is actually disqualifying coverage. So if you are signed up on a high deductible or CDHP plan with an HSA, that disqualifies you from participating in a medical FSA and vice versa. But you can use the limited purpose FSA with that HSA. So even if you change plans from 23 to 24, or sorry, 22 to 23, I should say, people, they will not lose out on that carryover funds. They will receive the carryover. It will just go to a limited purpose FSA instead of the medical FSA. No action is needed from the employee to do this. It will happen automatically as long as they, meet the minimum requirements, that sort of thing. They will still get their carryover funds. So unlike medical FSA, employees can participate in the limited purpose and the HSA in the same plan year. If an employee enrolls on the high deductible health plan with an HSA in 2024, they cannot enroll in a medical FSA. So yeah, again, it's just qualifying coverage, but they can still get the carryover from 23 to 24. It will just go to a limited purpose FSA instead of that medical FSA. Okay, so now we've got some examples of carryover scenarios. These are kind of like story math problems, just some, the carryover can be very confusing. So we wanted to give you guys some kind of more concrete examples of different scenarios that people might encounter and how the carryover is going to play out for those folks. So the first example is someone who has less than that $120 minimum remaining. So Sharon has $100 left in her medical FSA on December 31st of 2022. Or sorry, 23. We're going to use 23 as the example here. So she's not met that minimum. If she enrolls on the medical FSA in 24, okay, she will get $100 that will be able to carry over into the medical FSA in 24. And again, reason for that being, by signing up for the medical FSA in 2024, she has by default met that $120 minimum, so she can receive, any amount of carryover up to the limit. If she enrolls on a CDHP for the next plan year, then she cannot enroll on a medical FSA, right? That's disqualifying coverage. However, she can enroll on a limited purpose FSA. And if she does that, then her $100 will carry over and be added to that limited purpose. However, if she does not enroll on an FSA, either one, the medical or the limited purpose in 24, then that $100 she had at the end of 2023 will be forfeit because it is below the $120 minimum. Next scenario is for Jerry. He has $150 left in his medical FSA on December 31st of 2023. So he's right in kind of sweet spot. He hasn't hit the maximum, but he's above the minimum. Again, if he enrolls on that medical FSA, the 150 is just going to carry over to the medical FSA in 24. If he does not enroll on an FSA, either medical or limited purpose, that 150 is still going to carry over since he has met the minimum. And so it will just carry over into a medical FSA automatically. Now, if he enrolls on that CDHP plan in 2024, his funds are they're going to carry over into a limited purpose, no matter what. So if he signed up for a limited purpose, great, it'll just get added on top of his election. But even if he didn't sign up for an FSA at all, he will receive the $150 automatically into a limited purpose FSA in 2024. All right, so third example, we have Taylor, who actually has a balance amount that's above the maximum. So it has $650 left in their medical FSA at the end of December or the end of 2023. If they enroll on the medical FSA in 24, they will receive $610 of that $650 will get carried over automatically, but the remaining $40 difference will be forfeit. And it's same scenario. If they don't enroll in an FSA benefit, $610 is going to carry over to the medical FSA in 24, but $40 difference will be forfeit. They enroll on the CDHP in 2024. They can again get $610 carried over into a limited purpose FSA, but the remaining $40 will be forfeit. And then last example is for somebody who has who received that collective bargaining agreement funds, the $250, and they didn't have another election. They just received the $250, and example here is George, and George did not spend his money by the end of the year. He just didn't touch it. That $250 is sitting in his account, and he finishes out the year. So the carryover applies to CBA funds the same way it would any other elections, treated the same requirements. So if he enrolls on a medical FSA, the $250 will carry over into the medical FSA. If he does not enroll in an FSA, $250 will again roll over into a medical FSA by default. Now, if he enrolls on a high deductible health plan in 2024, then the $250 will roll over instead into a limited purpose FSA. Okay, and that was the final example. So with that, we're going to just talk a little bit more about the limited purpose FSA. So the limited purpose FSA, really, if you know the medical FSA benefit, it works almost exactly the same way. And we'll go into some more detail on that on the next slide. Really, the difference between a medical purpose FSA and a limited purpose FSA and a medical FSA, there's two key differences. One is that the limited purpose FSA will only cover dental and vision expenses. Medical FSA covers it all, medical, dental, vision. Limited purpose is just the dental and vision expenses. The second key point is, like we said previously, you can use it alongside a CDHP plan with HSA. Medical FSA, you cannot do that. It's disqualifying coverage, but the limited purpose can be used in tandem with that CDHP with HSA. Again, it's a pre-tax benefit. So just overview of how it works, and medical FSA works the same way here. You basically put aside a portion of your paycheck pre-tax every pay period. And this goes into funding an account that lets you cover dental and vision expenses. The annual limit for it is $2,850, and the minimum is $120. And so here we have, again, kind of a little bit of a timeline on how the benefit works. If an employee goes to sign up during open enrollment, they're signing up for the 2023 plan year. They're going to select an amount between $2,850 and $120. That's going to establish their annual election. This also would apply if somebody was hired mid-year. You know, they'd sign up when they're first eligible. The benefit would begin on the date of their benefit eligibility, and they would select an amount for the year. After their eligibility begins, after their first, beginning of their benefit, payroll deductions would need to start. So they would begin contributing towards that amount. And generally what you would do is take whatever their annual election is and split it evenly amongst all their pay periods for the year. And so they're basically sort of slowly paycheck by paycheck funding the account. And again, those funds are pre-tax. So that's really the kind of benefit of the FSA in general, is that it's pre-tax dollars. Funds for the medical FSA and the limited purpose, they are available immediately. So if they signed up during open enrollment, January 1st, 2023, they can access, and they signed up for, let's say, the 2,850, they can access that money right away, January 1st. They could go out, and if they had surgery scheduled or bought a lot of prescriptions, I don't know, they could potentially spend that whole money, whole dollar amount upfront if they wanted. And how they pay for it is they have kind of two options. One is Navia provides a debit card to all enrollees. The debit card allows you to access your funds directly. You can just pay at the point of purchase, essentially, and it will just pull the funds directly from your account. Or you can also do a submit claims for reimbursement. So generally, if you're going to the doctor or something, you'd probably have it go through the insurance processing. They would cover a portion of it, and then whatever they don't cover, you could submit as a claim for reimbursement against your FSA. For the limited purpose, again, that would only apply to dental and vision. Okay, and so for the limited purpose, I've got some examples here of different eligible expenses. For dental, you've got co-pays and co-insurance, cleanings, fillings, root canals, orthodontia is eligible. That's a big one under the benefit. For vision, you've got really any type of prescription glasses. You've got over-the-counter reading glasses are also eligible, over-the-counter products like eye drops for your eyes, but also, of course, visits to the eye doctor, co-pays, co-insurance, surgeries, that sort of thing. All right, and so that really kind of covers the overview of the carryover and the limited purpose. So the next question is, how do people enroll? How do they sign up for these benefits? So as you guys probably already know, open enrollment is running November 1st through November 30th. During that time frame, participants can sign up one of two ways. The first option they have is to go online through Navia's portal, and the website it's up here on the slide, PEBB.naviabenefits.com. As of October 5th, we've integrated Secure Access Washington into our portal. So employees would now log in actually using their SAW credentials. But they would log in using SAW, and that takes them to their Navia portal account, and they can make an election online. The online portal is awesome. It's definitely my favorite of the choices. It's super quick and easy. They get an instant email confirmation once they've signed up. And during the open enrollment period up until November 30th, they can actually go in and make changes whenever they need. So if they sign up for one amount and say, you know what, actually, I want to sign up for a little bit more, they can go in and edit their election through the portal. So it's really convenient. It's really nice. We love the portal. The next option they have is we do have paper enrollment forms. Those are available digitally. They will be available on Navia's website on the first day of open enrollment. So November 1st, we will load those. And the forms can actually be completed by the participant and returned to Navia directly. They can do that email, fax, or snail mail. They can also give it to their HR payroll person to pass on to Navia, but it's not required. They can just send it to us directly. And yeah, so those are really the two options. One caveat though is employees at University of Washington or Washington State University, they actually would not use either of these options. They need to enroll through Workday. We always get some participants who are kind of confused on that and try and submit a form or try to log on online, and they go to our customer service every year. So, we just redirect them back to using Workday. So, UW, WSU, you guys need to go through Workday. And yeah, they have, again, up until November 30th to submit their election or make any changes to their election. Navia does need to, if a participant's submitting their form directly to us, we actually need to receive the form by November 30th. It's not just post date. So they need to actually, if they're going to mail it, they need to mail it so that we actually have that form in hand physically on or before November 30th. If we get it on December 1st, it's late. We won't be able to accept it. So, yeah, that is it on the enrollment piece. So last slide here really is contacting us. If those of you, so the contact information I have up here is really intended for HR and payroll contacts rather than participants. So if you guys have questions at any point, but during open enrollment or throughout the year, really anytime, you can reach out to the Navia PEBB account management team, which is what myself and Chelsea were a part of that team. You can reach out to us via phone or email, and the phone number and email address are up there on the screen. We are located in Washington ourselves, so we're on Pacific time. So, basically between 7 and 8 a.m. or 7 and 5 p.m., excuse me, Pacific time. We will be available to answer your questions. And yeah, that's really it. So I think at this point we can open it up to question and answer. And I'll actually go back to that contact slide just so you guys can have that for reference.
Well, Sally, thank you for the great presentation you provided. And Deb and Chelsea answered most of the questions there, but it looked like we do have one from Pam here. Pam asked, my FSA card expires 12/2022. I'm planning to re-enroll in the FSA for 2023. Will I receive a new card automatically by January 1st, or do you need to order a new one? If so, from whom?
That's a great question, and you will receive a new card automatically. So those debit cards, they work just like normal bank debit cards. They're good for 3 years, and it's typically anywhere between 60 and 30 days before the card's expiration date. You will receive a new card automatically, assuming you are currently enrolled. I will say if you were not participating in the FSA this year, but you're planning to sign up next year, I would maybe recommend ordering a new card just to be safe. It typically, sometimes the programming doesn't work if you're not currently enrolled at the time your card expires, but otherwise you will receive a new card automatically.
Thank you.
Yeah. Oh, and sorry, I should say too, to order a new card, you can actually do it yourself through the portal, or you can call our customer service team and they can issue you a new card.
Okay, thanks. Anne had a question. What happens if the employee separates from service in June? Can they still use the FSA for the rest of the year?
The answer is it depends. There are a couple of options. So I'll say this, by default, when somebody terminates mid-year, the last day to incur for them is the last day of benefit eligibility. So if they separate employment, we'll say June 15th, their benefit eligibility is going to continue through the end of the month. So they have until June 30th. That's going to be the last day they can incur expenses, and any expenses that happen after June 30th would not be eligible under the benefit. They do still have the full claim submission period to get their claims in though. So they would have until March 31st of 2024 to submit claims. Those claims just have to be for expenses that happened during the time period they were eligible. So January 1 through, June 30th. There are a couple of options employees have though to continue the benefit if they want it, so that they can continue to incur expenses through the end of the year. I don't want to get too deep into it because that can become a whole nother kind of hypothetical scenario, but on our website, and this is just a general great resource for all of you, on that PEBB.naviabenefits.com website. And I'll just put it back up here. It's this one right here. There is a page, it's called Forms and Documents. There's like a little link. There's like a navigation bar at the top of the website, and there's a link that says Forms. If you click on that, there's pretty much all the kind of forms that you need throughout the year. And there is a form called the termination form. That's a form you can provide to employees when they are separating. It gives them their options for continuation if they want to. But if they choose not to do any of those continuation options, then it's going to be like I described. Last day to incur is their last day of benefit eligibility.
Okay, great. Thank you very much. We have another question from Molly. What happens if employees that start out in a union represented position and then transfer to a non-represented position? Can they still use the $250 for that year?
I believe if they've already received the funds, yes. As long as they're maintaining their PEBB eligibility, that shouldn't cause a problem. They would still just have those $250. Now, if they change between when they first became eligible on November 1st and when the funds are distributed in January, this one actually might be something the HCA would need to follow up on, but I believe they probably wouldn't qualify at that time.
Okay, we'll probably try to follow up on that question.
Yeah. Sorry. I guess I actually meant to say on that CBA slide that I will say this, Navia's, we're not really involved in determining eligibility for those CBA funds. Basically how it works is in January, the HCA, the Healthcare Authority, they provide Navia a list of eligible participants and we just set up their accounts. So this is just a question we kind of get throughout the year where people are saying, well, I thought X employee was eligible. Why don't they have the benefit? Or is X employee eligible? And those are questions Navia can't really answer. We can confirm whether somebody got the money. We can explain how the FSA works, their deadlines, all of that. But in terms of is employee eligible? Yes or no? Why are they eligible? Why not are they eligible? Those questions, please direct those to the Healthcare Authority.
All right, thank you very much. Is there any other questions out there we can try to answer for you? Looks like Lisa has a question to clarify if an employee has an FSA for 2022 and during open enrollment, they decide to switch to a medical plans to the CDHP with the HSA for 2023, will they have eligible carryover funds and those carryover funds be automatically rolled into a limited purpose for FSA?
Yes.
Lisa, I hope that helped you. Anybody else with any questions we could try to answer for you? Hi, Kate. So again, how does HCA get information that employee is eligible for the $250 for the CBA? And OFM provides that information for us. So OFM gets that information and lets us know about that as far as the funds and everything. So I hope that answers your question. Who's got a question here? Employees' contributions can vary each payroll throughout the year, or it should be the same for each payroll?
It should be the same for each payroll. There might be scenarios where a person's deduction may need to change mid-year. Usually if they went out on a leave for some period of time, when they return from that leave, if they weren't getting paid, their deduction may need to be adjusted at that time. But generally you should be taking the same amount every paycheck.
Thank you very much. Pam, I know you have a question about creating SAW accounts, but there's a help, button there on the SAW account webpage thing that you have people, if they're having problems, creating a SAW account. That's nothing that really can help with an HCA or Navia in general. But again, there's a help button there for people who are having a problem with your SAW account. Another question from Pam. If an employee separates for 3 months and is rehired, does their benefits start right back up or can they still use the $250?
Yeah, that's a good question. If employees separate and they have a gap in employment longer than 30 days, then they actually are no longer eligible to re-enroll on the FSA that same year. They would have to wait until next year to sign up. And sorry, that also applies to the CBA funds.
Thank you very much. Is there other questions? I think, Emma, are we sharing the slide deck with people? Deb?
Yes, sorry, I had to unmute myself. Okay, yes, I was gonna ask Sally if she could go ahead and make sure we get a PDF version of her slide deck, and we will be happy from HCA to forward all of that to today's attendees.
Yeah, absolutely. I can provide that once we're
Thank you.
done.
Cool, thanks. Gretchen has a question. We were told that adjunct faculty that lose eligibility but don't separate employment can't re-enroll the same plan year. Is that correct?
Yeah, unfortunately, I cannot answer that question. I think that's something you may need to ask the HCA. We don't really know the specifics on eligibility rules based off of like hours and position. Yeah, so I would say that that's a question maybe the HCA would need to follow up on.
Yeah, Gretchen, maybe ask that question through HCA support and we could try to get an answer for you. Let's see. They did have a question that says that they become when they come re-eligible, Navia is told we can't re-enroll, but again, I probably need to answer that through HCA support. All right. Any other questions out there? Going once. Going twice. Well, everybody, thanks for coming today. I really appreciate it. A special thanks to Chelsea and Sally. I really appreciate it, and Deb too. If there's no other questions, we'll sign up for today, and thanks for everybody for coming.
Yeah, thank you all. And again, just put up the slide with our contact information. If more questions do occur to you, please feel free to, send those to that ESteam4@naviabenefits.com email. And yeah, I hope you guys all have a great day.